Hello friends, my name is Dr. Gambhir. I am the Group Director of Cardiology at a large group of hospitals in the NCR of Delhi. Formerly I was Professor of Cardiology at Pant Hospital for almost about 18 years. Quit the academic position in 2002 and then joined Kailash Hospital as the Group Director of Cardiology. Today I am going to tell you something about heart, how does it function and how does the heart attack occur. As we all know that heart is one of the most important organs of the body. It starts beating from almost about 6 weeks of the intrauterine life, that means before even the child is born, and it continues to beat from birth onwards till the time the person dies. Or in other words, you can say that when the heart stops functioning, heart stops beating, the person is declared as dead. So therefore one can understand the importance of heart in our survival. Heart, as you know, is a strong muscular pump. It is lying in our upper part of the body called chest to the left of the breastbone, which is right in the center of our chest. And this strong muscle pump in medical language is called myocardium or heart muscle. Now, as we know that heart has to perform very important functions in the body. It beats almost about 10,000 times every day, 2.5 billion times during the lifespan of an individual, and moves almost about 8 tons of blood every 24 hours. Now, it doesn't mean that the body has got 8 tons of blood, but it is a closed circulation. The heart receives blood from the whole of the body. It then sends the blood into the lungs, where it is mixed up with the oxygen that we inhale from the atmosphere, and then the pure blood, which is we call as oxygenated blood, is then thrown into the entire body for the body to perform its function. So today we'll talk about the area of how the heart receives its nutrients and oxygen supply and how does a heart attack occur. There are 3 important arteries. Arteries are the blood which carry oxygenated blood into the heart muscle and elsewhere in the body. So there are 3 arteries which arise from a big artery which arises from the left side of the heart called aorta. These arteries are known as coronary arteries. Basically, these 3 arteries have their designated areas of supply and they supply blood and oxygen to the heart muscle to perform its function. Meaning thereby that if the heart has to perform more functions, that means if the person is exercising, if he is tense, if he is angry, when the heartbeat is faster and heart has to send more blood to the entire body, then these coronary arteries carry more blood to the heart muscle, and that's how the heart muscle is able to perform more functions. Now these coronary arteries are the ones which are responsible for the heart attack to occur. The classical example is that these arteries are, of course, first you must understand that are small tubes like arteries over the surface of the heart. The classical example is that once you build a house, you have installed the water pipes, and after 15-20 years you would see that the water pipes, they start rusting and the flow of water in these pipes is reduced. Similarly, as the age advances, the cholesterol which is moving in our blood and is important for carrying out several functions in our body starts getting deposited in the wall of these arteries, and over the years this deposited cholesterol, which is known in medical language as plaque, increases in its thickness. It encroaches into the lumen of these arteries and ultimately chokes the arteries. And once the artery gets significant blockage, gets significantly choked, significance means more than 70% of the artery is narrowed down, then the person starts getting pain, which we call it as angina. This pain most often comes on exertion and is relieved by taking rest. So that is one form of presentation of choking of these coronary arteries by deposition of cholesterol. Now on the other end, a cholesterol or a plaque, when it gets deposited in the wall of the arteries, may not be severe enough. It may be only blocking 30, 40, 50% of the artery lumen, but suddenly the inner wall of the artery ruptures, and once the arterial wall ruptures at a place where there is deposition of cholesterol in the wall of the artery, then the cholesterol comes in contact with the blood which is moving in the lumen of these coronary arteries, and here a chain of chemical reaction sets in. This leads to aggregation, deposition and clumping of cells called platelets. Now, as you might have heard that platelets are very small cells in our blood. They are run into lakhs, millions, and they perform dual function. If a person has got a cut, then platelets get adhered over that cut site and they stop bleeding. So that is the better side of these platelets. But on the darker side, these platelets, once they come in contact with cholesterol and the chemical reactions take place, they start aggregating and depositing at that site where there has been a rupture. They form a plug of clot called platelet clot, and this chokes the artery and leads to a sudden occlusion of blood supply to a segment of the heart muscle, which starts dying within minutes, and the process of death of these heart muscle fibers is completed in about 1.5 to 2 hours. So this is what is known as heart attack. And during this time the patient gets severe chest pain, he is very restless, he looks pale, he is asking for, he is sweating, and he is holding his chest, compressing his chest and trying to seek help. Now often a question is asked that, doctor, I was alright till yesterday, I had gone to a height of 5,000 feet, Mussoorie, Shimla or anywhere else. How can I get a heart attack when I was totally alright till yesterday? Many times the patient and his relatives are not willing to believe or accept this reality. It's very easy to understand. We classify these deposits of cholesterol in the wall of the arteries as soft or vulnerable versus those which are stable and not likely to rupture. So a unstable plaque which has got a lot of fat inside it, very thin layer of blood vessel lining over it, is prone to sudden rupture under stress. And that stress could be a sudden rise in blood pressure, anger, anxiety, etc., etc. And once it ruptures, a soft plaque ruptures, then this whole chain of events sets in and a person can get a sudden heart attack. So this is very easily understandable that a 40% blockage not have led any symptoms to a person who has even climbed Mussoorie or the hills of Shimla, but can suddenly develop this process of rupture of an unstable or a vulnerable plaque and then can get a sudden heart attack. And that's how we explain that this heart attack can come as a bolt from blue. In contrast to this, there may be another situation where the blockage may be 80 to 90%, 95%, and there may be a stable plaque, and a stable plaque is one where the lining of this plaque is very thick, is not likely to rupture. Now, such plaques continue to grow like this, and they may grow very slowly, and a person may only complain of chest pain on exertion and is not likely to develop an acute event like a heart attack. For anyone to understand and accept the fact that a heart attack can come as a bolt from blue should be very easy, as I explained, that a sudden rupture of a vulnerable or a soft plaque can take place and can lead to a heart attack. Now, unfortunately, the science as yet has not come to the stage of knowing which are the plaques which are vulnerable or unstable and which are the plaques which are stable or not likely to rupture. A lot of work is being done in this field, and over a period of time, non-invasive methods may help us or may enable us to find out which is a plaque which is unstable and can rupture and lead to a heart attack. And then we can institute therapies both in form of drugs and possibly intervention like putting in a stent to prevent sudden rupture of a plaque. So that is how the mechanism of heart attack occurs. Now once the heart attack occurs, then obviously the treatment of heart attack is immediate attention of medical specialists who are experienced to treat heart attacks. Person should be immediately rushed to a medical care center where specialized cardiology facilities are available, and today we have come to a stage, there is a shift in paradigm in the treatment of heart attack. Gone are the days in late 70s when persons with heart attack used to be put in the coronary care unit and the only treatment was just monitor their heartbeats, and if any irregularity occurs you just treat it, relieve him of his constipation and then ask him to take rest at his home after discharge for a period of about 6 weeks to 8 weeks. Today the treatment is establishing reperfusion in the artery which has got clogged, which has got blocked, and the best possible form by a procedure called angioplasty. Patient, once he is in a center where such facilities are available, immediately is taken to the cath lab. The blocked arteries visualized by injecting a contrast agent into the coronary arteries in a specialized lab called cardiac catheterization laboratory, and once there is a complete occlusion of the artery, a thin wire is passed and then the clot is sucked out with a small tube. Following that, a stent is deployed which holds the artery and keeps it open. Now this can be achieved in about half an hour to 35-40 minutes and can prevent the massive damage of the heart muscle. But the message should be that time is muscle and muscle is life. You should act as early as possible. Do not waste time in carrying out homemade treatment when you get a chest pain right in the central chest with profuse sweating, and come and seek medical attention so that no important time is wasted and the doctors act very fast. They establish reperfusion in the totally blocked artery. The earlier you open, the more the heart muscle you save. The more the heart muscle you save, the better will be the heart functions and longer will be the survival. So that is the crux of my talk today, that time is muscle, and heart attack, which can come as a bolt from blue, should not be ignored, and person should be rushed to a specialized center for a timely treatment, saving his heart muscle and saving his life.